Hello, everyone, and welcome to another episode of hashtag CRA Arthritis. And we're getting to talk to all of the great and smart people that are presenting there. And one of the topics is about osteoarthritis. It's the most common type of arthritis. It's the leading cause of hip and knee replacement surgery in Canada. In fact, 69% of hip replacement and 99% of knee replacements are performed in people who are living with osteoarthritis. Today, we're joined by Dr. Mary Westby. She's a clinician-scientist at the Center for Aging Smart, a physical therapy clinical resource educator at the Mary Pack Arthritis Program, and a clinical associate professor in the Department of Physical Therapy at the University of British Columbia. Dr. Westby, welcome back to our show.
Thank you so much, Kelly. Pleasure to be here.
We're going to focus today on one of the posters that you're presenting, and it is the feasibility study to implement quality indicator toolkits for rehabilitation after total hip and knee replacement surgery. So to start off for our audience, I noticed one of the terms that you use is high quality rehabilitation. What does that actually mean? And why is it so important for recovery for patients?
Great. Thank you. Yeah, high quality is the concept that a lot of healthcare institutions, provinces, countries use to describe the overall delivery of care. So, high quality care in healthcare means it's accessible to people, it's appropriate to meet people's needs. It's efficient, so the system or the payer can afford to deliver it in the way it's designed. It's effective, so it does what it says it's going to do on outcomes that are important to patients or their families. It also means it's safe, and it's respectful of individual cultures and needs. So high quality care would capture ideally all of those aspects of care, whether it's at the individual provider clinic level or at the provincial healthcare or at a broader system level.
I'd like to look at the toolkits and specifically what resources there are and how they're meant to help patients get better outcomes after surgery.
Great. Yeah. And so our toolkit, which is basically it's an online, imagine it like a toolkit that patients can use to open up, access on a website in this case, different resources like checklists, booklets or trackers, communication tools, infographic posters to kind of get the key or the gist of what is high quality care in the rehabilitation after hip or knee replacement. And so the idea is that they could use whatever they're comfortable using to have conversations with their therapist, because physical therapists are the primary providers of rehabilitation after a hip or knee replacement, and feel comfortable asking about different aspects of their care, such as, are you going to assess my balance? I did fall a couple times in the year before my hip replacement. I feel like my balance still isn't good. Have you assessed? Has anything we've done so far been to assess my balance? And if not, could you tell me how I am and give me some exercises? And so assessing someone's balance, because we know people are at high risk, anywhere from 40 to 50% of people will fall in the first year after their hip or knee replacement. So we want patients to know that that's an aspect of better or higher quality rehabilitation. And now when it's written in these various formats or resources or tools, they have something that they can bring forward and let the tool do the talking for them if they're not comfortable necessarily questioning or asking for some aspect of care with their healthcare provider.
Now, you're not the first clinician or researcher um, that I've had the conversation about how difficult and what the challenges are to change clinical practice. In this particular example, what needs to happen to improve consistency of care?
That is the biggest challenge, behavior change for all of us, whether it's us personally adopting a healthier lifestyle like biking regularly, eating healthier, getting that extra hour of sleep. It's human nature to not want to change and to go into a default mode. So we're tackling this attempt to improve clinicians' behavior, which in this case is really adhering or trying to meet those guidelines from a number of different ways. One, as I said, we're giving patients the tools and resources so they can prompt or ask the clinician from that sort of avenue around what they should expect. And then we've also developed a comparable toolkit, which is called the quick toolkit for clinicians, with a number of resources and tools and guidance and an overview of the research that supports this to inform the clinicians what they can do. And then there's compatible things for both of them in terms of, like I said, infographics on the wall and videos and posters and things like that. So we're coming at it from both ends, hoping the clinicians will better understand, because we know sometimes it's knowledge. I just wasn't aware that that was important. And then we're also tackling it from a behavior perspective. So the clinicians, when we did a focus group with them at the beginning of the study to identify what would likely be a challenge for you making a change in your clinic and adopting some of these quality indicators, number one was lack of time and the way clinics are set up and having patient after patient and not sometimes juggling multiple commitments at the same time. So we looked at efficiencies of how we could get the information across. Another one was they kind of do or seek out guidance on what to do from their peers, from their fellow therapists in the clinic. And so we brought in a clinical champion to each clinic. And that was an individual within the clinic who was a bit of a thought leader, maybe had more of an educator role, who would help to promote and remind them and encourage them to keep looking at these indicators and maybe looking at something, how they could change their practice. And then we also did something the clinicians came up with themselves because reminders, simply forgetting that this is the better way to do something is also, a challenge. So they wanted weekly reminders. So there are 10 quality indicators. So we created 10 weekly e-blasts. We call them Toolkit Tuesdays. So every Tuesday, they got one quality indicator highlighted, the quick link to it, why this is important, and week after week. So that was some of the active behavior change strategies that we used in an attempt to get clinicians just to shift even slightly the way they do things.
That is really fantastic work. I congratulate you on that. And I want to um, sort of balance or complement that with what about from the patient perspective, what should they do? What can they do to make sure that they're receiving the kind of high quality rehabilitation that you're describing in the study?
Well, I think first is to be aware of what it is. What should they expect? These quality indicators are considered the minimum or minimal, sorry, standard of care, not even the best possible care. There's clinics and providers who provide even state of the art, well beyond these. So at a minimum, they should expect and deserve to receive these aspects of care. So to know that that's their right and there's good evidence and it's doable and it's in the settings that they're receiving the care. So to feel confident in that way, and also just to have the confidence and again the tools, the information so they build sort of can self-advocate and engage in their own care and make sure it aligns with their expectations. So we have some expectations around what is the minimal standard of care you should receive, but use those as well as your own expectations and have that conversation with the therapist. And some people are very good at self-advocating and could you check this? And I'd like to be able to achieve this. So I'd like you to give me some exercises to help me with that. And others are just more less engaged, maybe more intimidated. Maybe there's some language barriers or health literacy barriers, or you've given me a whole bunch of handouts, but I'm actually struggling to read that or understand what it is. And so they're not confident to have the conversation or ask for what they deserve or what they want. So I'm hoping that some of these tools, and when we asked the patients, 4 out of 5 of them did say it helped them to engage more in their own care and take on some of that role because it is their journey and it goes well beyond the 2 to 3 months of rehabilitation to fully recover.
Great answer. And just to let our audience know, there will be links at the end of this where they can learn more and hopefully pick up some valuable advice and understanding to apply to the next time they make a visit to see their specialist. I'd just like to close off this is the feasibility study. What are the next steps for your research?
Yeah, thanks. So a feasibility study is really the trialing the methods, the approach where clinics engaged. Were we able to recruit people to participate? Did they access the toolkit? Would they have liked something else? How much did it cost us to run this study at two sites? What would it cost if we ran it at multiple sites? So the next step is really to ramp up that sort of the design of the study, which was to bring on two clinics at a time, follow them for a few months, and then introduce them to all these resources, actively support them for 3 months, and then sort of let them run on their own and see, do they continue to use that? And the next level step would then be to do a larger study. It's got a fancy name called a step wedge cluster randomized trial, where you onboard or introduce two clinics at a time on an ongoing basis until you have about, say, 8 clinics involved, and you watch how they use and access the toolkit and see if it results in any improved behaviors from the clinician and any patient outcomes. So that would be the next step with this.
Very exciting. And it's always a pleasure talking to you. You are one of the leaders in Canada, changing rehabilitation care for patients today, but also future patients living with osteoarthritis across Canada. So, always very thankful for you to join us, Dr. Westby.
Thanks so much, Kelly.
And thanks to our audience for joining us. And we look forward to seeing you again for another episode from CRA Arthritis. Bye for now.